Thank you all for taking a pause this morning to hear from me, and we're very fortunate this morning. We have Ms. Neldia Dycus, who's the director of the Central Arkansas region of the Department of Health, and she'll be answering any questions and giving you a few words in just a moment. But I wanted to start us off this morning. You know, this department, Public Works, according to HR, only has a vaccination rate of 28%. That's only 1 in 4 people who are vaccinated and protected. And so I thought maybe I would give you my perspective from what my job has been during this pandemic, which you got to be in close to the same position as me. This isn't getting old, it's getting real. We're headed for 2 years now, and doesn't seem like it's ever going to let up. So some of you may know the Constitution requires the county judge to be in custody of all county property. That means the cars, that means, you know, your shovels, that means every building in the county, it means the jail. I don't run every building, but I'm in custody and responsible for every building. So along with that custody goes certain responsibilities. I'm obligated by law to provide a safe and well-being environment for all the employees of the county and for all the members of the public who access the services that you provide. And the services that we provide, especially, you know, road and bridge, animal control, sanitation, planning, emergency management, all those are vital, essential, to use a term of the day, essential services to the public. And you know, the experts tell me I'm not the smartest or the sharpest knife in the drawer, so I've always learned to try and seek out the smart people, the people who were better educated than me, that maybe had different experiences than me. And so those that I sought out tell me that we have just a couple of ways to try and combat this pandemic, which seems to get worse and worse every cycle. And that is to try and wear masks, social distance, wash your hands, those basic things of transmitting germs and virus. But the other thing is to take a vaccine. And there's that controversial subject. I mean, gosh almighty, we couldn't probably find anything that people would argue about harder. But the reality is it something that has been stemming the tide and will help us to stem this tide now. If you look at any of these charts of how many people are sick, I mean, over 50 people died last week in Pulaski County. In the state. And that's a lot of people when you multiply it by now a year and a half. So our loved ones are threatened. The people who work next to you are threatened. I'm threatened and you're threatened. So I hope that those who've been reluctant will take the advantage of the opportunity to have an expert here with us this morning to ask questions that you may have, to voice concerns about things you've heard or maybe read on the internet. But it's important, and as public employees, you know, we talk about the government, and I was telling somebody yesterday, you are the government, you work for the county. And we have a real obligation as men and women who work for the public to try and do everything we can. So I hope that those who maybe have closed off their mind to trying the vaccine will give that new consideration and listen to what Ms. Neldia Dycus has to say to us this morning. So again, thank you for being here, and please welcome Ms. Neldia Dycus, the Director of Central Arkansas Public Health.
I don't normally get applause. Working with the health department is not a glamorous job, and I am a registered nurse. I will get right out there with my staff, and I have gotten out there with my staff, and I got COVID, even protected. Luckily, I survived, and when I leave you this afternoon, or today, I'll be going to a funeral of a relative, and received last night a message that I've lost another relative, and lost a relative 6 months ago. And this may not have hit you in your home yet, but it sure has hit me in mine. And so I'm thankful that I'm able to stand here before you, and the so-called COVID brain is real. I really thought I was losing it, getting old, and thinking about retirement, because after that episode of COVID, my mind was cloudy, and I've got 3 or 4 notebooks. And now it's just a habit, take notes, because people would tell me things, and I think, no, you didn't tell me that. But I thought, oh my God, I'm a mother. But in fact, things like that do happen. But I was even telling myself yesterday, hey, you're back, you feel good. And those masks that you're wearing today, I'm really glad that you're wearing them. I hope you're wearing them for your partners and your teammates, and not just because the judge is here, or that you've been called to order. Those masks aren't going to protect you. Who they protect is the people standing beside you, the family members, everyone that you may come in contact with. The purpose of those masks is so that if you cough, sneeze, or sing, it's going to contain that, your own personal body, they call it flora, to you, and the same to them, so that if they cough, sneeze, or whatever, you don't get it. And so, that's a real gift, that something this simple could help mitigate something that is so horrendous that has hit our country. On about March the 11th is the day that the Department of Health said, our leader then, Dr. Nate Smith, said, stay home. If you can work from home, stay home. And so I had my computer, and I said, I'm staying home. And that day, there were 5 cases of the COVID in Arkansas. And every day we get a report, and I stuck it in my car, and I need to show you that it goes to the governor, that that's real. The information that's put out there, that the governor put out there, is not political. It's not from a bunch of quacks. It's from a bunch of experts that I work with every day. And it also is generated by my staff. In the 7 counties that I manage, I have 14 clinics. And in those clinics, we do shots, we do testing. If some people show up sick or not, they'll lie to us. They'll come in for an exam for something totally different and have COVID and not tell us. And so probably about the first month, my staff started falling out. We are running now, doing all services on about 40% of the staff that we had from the beginning. And watching those numbers, the staff watch those numbers, because I try to be transparent. I want them to see the reality of what they're doing, who they're touching. They got to go home to their families. They've got to be careful. They've got to be safe, and they got to take care of you, and you, because it's public health. And it really is a selfless job for them to do that, just as the hospitals. But watching those numbers grow, within a month they were 64, and that first year, it got up to a few thousand, and I wish I had my exact numbers, and then it exploded. And it has really exploded in the last 6 months. We are getting close to 500,000 people that have had COVID. And, there's only 2% of ICU beds left in the state. How real is that? When you look at the number of ICU beds. Yesterday, we lost 3 babies at Children's Hospital, all due to COVID. And I've had people challenge me and say, oh, well, Neldia, they must have had comorbidity. They had something else going on with them. So does that make them less a child, a less a baby, a less your grandchild? No, it doesn't. It just means they were sick and someone didn't protect them. And it had to be somebody close to them because they were at home, those babies. And right now there are 27 kids in the hospital, right here in Little Rock at Children's. Could be from anywhere in the state, could be all from Pulaski County. I don't know those statistics. So this is not about religion. This is not about politics. I avoid those things at work. It gets in the way of my job. I cannot do what I need to do. And your health department, I've got 30 environmental health specialists. They're out there making sure your water's safe, your swimming's safe, your food is safe. I've got disease intervention specialists out there chasing people down who have sexually transmitted diseases so they don't continue to spread them. We not only have a pandemic here for COVID, we also have an epidemic of syphilis. Didn't come to talk to you about that, but it's here. The Hep A, Arkansas has an epidemic of hepatitis A. Preventable diseases, just like the COVID, is preventable. If you get the COVID vaccine and you get COVID, you are guaranteed that you're not going to get sick and die. Now, if you have severe diabetes, severe other diseases, that's not a 100% bet I would lose my money because you're already battling other issues. But if you get the shot, healthy people, right now 57% are between the ages of 20 years old and 54. And when I was thinking about that last night, I said, those are the workers. Those are the people that are out there shaking and moving. And that's you. And so you're in that age group. And some of you are a little older. Right now, in the ages 65 and up, 14%. But 20 below, 14%. So it's pretty easy to see, you know, where our issues are. And, you know, I'm here when Judge Barry called me, I wanted to help. When he gave me those statistics, I thought, you know, I battled with my own staff. Took shots with my own staff to see me, to be a leader. I was going to take it. And I'm glad I did. And as y'all may have heard yesterday, that Pfizer has been approved for a third dose for the high-risk people, which I'm really glad. The other statistic is, I hear people say, well, I've already had COVID, so I'm covered. Those antibodies won't stay with you. So you need a booster. So even me having COVID, then I got my 2 Pfizer, I got a booster. And I will, as soon as they say I can. I'm not in that group yet, but I'm over 65. So when they say I can get that booster, I'm going to get that booster to protect myself and to protect you. The interesting thing about this little sneaky virus is you can't see it. You just can't. Look at your hands. If you've all had health class where you see 50, put a black light on your hand, spray stuff, and you see all the bacteria or all the things that's left behind. I mean, that we have bacteria and bugs that live on our body. This is our ecosystem. But this is a virus that has never been in our environment. Our bodies have never recognized it. We were not born to recognize it. And as children, many things that they're born that they haven't recognized, their body is attuned by your genetics to recognize. So this is something very different. It's the first time we've had something like this that has gotten out into our public and that we're trying to control. And so we can't do it without you. So that's my speech, and I'm speaking to you. But truthfully, I'm not trying to put one arm behind your back and say, you get this. I am asking you to make an educated, conscientious, compassionate decision for your family and for people that you've never met to get the shot so that, one, you won't end up in the hospital. My question is, who's going to pay for these hospital bills? I mean, they're unbelievable. My one visit to the ER when I had it was $5,000. I spent 4 hours there. Now, of course, my insurance kicked in, but it was still unexpected out-of-pocket money. That wasn't nothing to laugh about. I work for my money. I like to take care of it and like to take care of me. So, after saying that, also, I'm going to leave this with you. You may have seen this in Sunday's paper. It's about myth busting. And Dr. Jennifer Delahaye, who's a very good friend of mine, who is the new chief doctor for the health department, and she's an infectious disease specialist and a pediatric specialist. She wrote this, things that she picked up, and I thought, well, this is really interesting. That maybe I know, like my husband's railroad, they'll throw this stuff on the table in the New York Times, and so when guys come in for lunch or breakfast or break, they fill it in, or they read to each other. So it's interesting, and if there's a myth that you've heard, or there's something that you've heard, or you're concerned, I'll be happy to try my best to answer. But I can't get into a political debate, and I won't get into a religious debate. I respect your feelings, But I just want to say to you, I work amongst the healthcare professionals in this state, and they're not a bunch of know-nothings, losers, probably some of the highest educated people I've been around. And just because we're Arkansas doesn't mean that we've got stupid people here. We've actually got really highly intelligent people. And because the University of Arkansas Medical Center and the School of Public Health, which I attended, people come from all over the world to go to that school and study public health. So, you know, I just want you to stop and think when you hear stuff. When I hear my friends, my school graduation's coming up. I don't know how we're going to do it, but some of them are just downright stupid. They talk stuff, and I know it's not polite to call them names, but they call me names, and we're all friends. But I just thought, I can't help them. And I had another friend call me and say, well, what are we going to tell them? You know, when they're arguing about it. And I said, you tell them you love them, and you're going to miss them. And that's the best thing, you know. You can't fight it, but all I can say is think for yourself, think for your family, and look it up, call people. I mean, I like Google. I Google stuff all the time. I like Facebook. Pray for discernment so that you can protect yourself, protect your family, protect your coworkers, protect your community. That's your responsibility. Okay, I'll take any questions that you might have.
When's the booster going to be available for everybody?
Well, you know, I was real excited yesterday afternoon, got notified, like I said, that the booster was available for the high-end sick people. They're moving fast. One is this emergency use that they call the EUA. Well, let me say to you that they're moving fast, and with all the vaccines and all the responses to the vaccine, that's a research. We're a living research so that they can move faster, move faster. I'm looking for that. I'm looking for the 12 and under kids. You know, I'm looking for everybody to get the J&J, which today, by the way, we brought 100 Johnson & Johnson one-time vaccines, very effective, because I know it's hard to get off. And then we've got a little bit of Pfizer for those that just can't imagine taking the Johnson & Johnson. We give a lot of Johnson & Johnson because not everybody, you know, it's get it when you can get it and go and get that protection, because it's 87% and maybe even in you it could be 100% effective. Everybody's body's different. Okay? Thank you.
Repeat the question. So
Oh.
that's your question.
I'm sorry. He wanted to know when the booster is available for everybody. It won't be long. It's coming. And we've got plenty of vaccine even in the state of Arkansas. So.
I have a question.
Yeah.
It's from a personal standpoint. What have you heard about long haul? Anything about that? Any studies coming out? Anything in the state of Arkansas that's new and encouraging, perhaps?
Yes, he was asking about the long haul after getting COVID. You know, that long haul means I didn't just have a few symptoms, my cough, my sneeze, maybe a touch of pneumonia, fever, diarrhea. You may just have diarrhea and no other pains. And so, you know, that clears up. But remember I was talking to you about the COVID brain. COVID brain is a long haul. Some people actually feel more like dementia. Some people, they're doing research after research on women who have issues with their hormones going imbalanced and maybe having a menstrual cycle when they hadn't had menstrual cycles, even while they may be on birth control. So yes, you know, they are researching. They've researched headaches. They've researched, you've heard Guillain-Barré, where, you know, I've seen on Facebook 2-3 times someone say, oh, I'm walking backwards now instead of walking forwards. Well, or I'm really dizzy. It is true. With the COVID, particularly if you have issues, other medical issues, it can actually unlock a key. You know, you think about diabetes that you've been riding kind of on the scale, and then you get really sick. It wasn't the COVID, it's the fact that your immune system got so low that the illnesses, we call them, of opportunity arise. And so that things are being studied, and the numbers are very, very low, and even in Arkansas, very, very low. But again, this is new. This is a new disease, a disease that's 2 years old that we're aware of. We don't know where it came from. We don't know where it's going. But what we do know is that it's mutating, which is what viruses do. That's what bacteria do. That's what we do as human beings. We are, a part of this ecosystem. So the new one that we've got, Delta, is they call it virulent. It is really bad. There's another one called Lambda that's coming down the pipe. They don't know so much about it, but they also know that there are others. There are mutations that we don't even know because they don't test for them, and they're not going to bother themselves looking for it if you don't see any difference in the symptoms. But when they start seeing this long haul where you've got 3 weeks after to 6 weeks to 6 months, and believe it or not, we've been in a 2-year disease process, and some people still are sick for 6 months. Some people may have never turned back. But it's important, and it's important for the scientists. And I would like to see everybody have a mask, everybody get their shots, so then the scientists don't have anything to do. They can turn and look at something else, because there's always something that's coming down to get us, and we have to be aware. Anybody else? I don't mean to sound preachy, but I believe in this, and this isn't paying my paycheck. As I was saying, we've lost more than 60% of our nurses, and because you don't even hear about my nurses. These ladies in here that come to give shots are on the front line every day. So someone says, well, where are the nurses going? Some are staying home, and some are working in other parts of healthcare that they don't have to deal with COVID anymore. They're burned out, they're tired, and they're moving around. They're somewhere. I'd like to have a few of them. And my clerks too, losing my clerks. They're scared. They don't want to have to deal with the public. And we have to be kind. We are customer service. We're, public servants, just like you guys. And you take abuse. I know people aren't always friendly and kind because that's that human condition.
Are we going to have to take the vaccination again, or is it does it last a certain amount of time, or?
Well, there's kind of two thoughts on that. One is that it's very possible that, I'm sorry, he was asking, will we have to take the vaccination again? And again, because they're saying they don't know how long it will last. Example, the flu vaccine. It's a viral vaccine. It's a dead virus. It has 4 different types of vaccine. They call it quadrivalent. And every year they say, get it. Well, there's over 120 known flu viruses. And there's probably many that they don't know about. But what it does when you get that shot, it builds your immunity. It keeps your immune system awake so that it recognizes something similar. Chicken pox. Right now you get 2 vaccinations as children. They think you're done, and then one day you wake up and you got shingles. Well, that's chicken pox. It's just in it goes down the nerve path. So they ask when you're over 60 to get another one. Measles. Every year when Walmart has their big gathering, we have people come from other countries, and measles is one of the issues. And we even 2 years ago, well, no, it's been 3 years now, we had a huge measles outbreak in Arkansas in the northwest region from someone coming from China. The Americans, we'd had our measles, they still got measles. So they're still doing the research to find out. They tested them, they still had some immunity, but why did they get the measles again? But they got a very low level. So just like the COVID shot will not stop you from getting COVID. But what it will do is help you not get sick and die. But because it's a virus, you're going to get it and you're going to give it to someone else, and it may not affect you. You may just pass it right through. Hepatitis A is another type of virus that does that. So a virus does what a virus can do. And so if you study viruses, then you start making your own hypotheses about what are the possibilities. And that's it. There's no A and B. There's an A, A.5, a 2.5, a 3.0, depending upon how you are, or even clusters of people. So we're hoping to get it where it will be. And I know what's coming down the horizon is that we're going to have a new test, and a PCR DNA test for COVID, but it also tests for flu. We do a lot of flu in the health department. This year, if y'all would look at the flu statistics, it looks like it's been eradicated, but it hadn't been eradicated because COVID had tougher symptoms. So now we're still looking because people still die of flu. And so we can't forget what we know to take care of this. You got to take care of this and this and this. And so hopefully, to answer his question, that it'll be squished like polio, but we still, that's called enterococcal. We still have enterococcal out there affecting children. Y'all remember hearing about the kids, and y'all hadn't heard probably the last 2 years, that having this disease. I know it's on CNN every night. Some disease acts like polio. They don't know what it is, and in the hospital. Well, it's similar to polio, but it's not polio, and they haven't come out and said it's a mutation, but it's kind of gone away. So it comes and it goes. So it's just human nature. Well, I hope I've helped you. I hope you believe me. I'm here because I believe me, and I think your boss believed in me. And if anything, if 10 of you will step up and get that shot, I will go back and report, well, that was successful. We've been invited some places, and nobody took us upon it. Nobody. And brought the nurses out, brought the clerks out. These ladies work in the clinic, except for 2 of them I've got doing the paperwork. One of them's our regional emergency preparedness leader, and then the other's the assistant emergency preparedness leader. I made them come and help me so I didn't have to pull anybody out of the clinic. So I hope you'll consider it and do the right thing. Thank you.
Thank you, Neldia. Give a big hand and a big welcome to Neldia for coming out here before 7 a.m. this morning. And I always think that we're very fortunate when the smart people do take time to come and talk to us and share experience with us. And I already explained to you my obligation to protect you and protect the public. And so I urge you, take advantage of the opportunity to get a shot today. Take the single shot, take the double shot, and we'll schedule a time to have folks back out here in 2 or 2.5 weeks so you can get the second one. But I encourage you to open your mind to it and take the shot. Come on, folks. I mean, we got mostly a bunch of big, strong, tough men standing out here, and a prick in the arm is not a whole lot of anything. So I encourage you to. And I thank you for taking time and listening to me this morning. I care about your well-being. I care about the Pulaski County general well-being. We've invested a lot of money in the last 7 years that I've been here now in trying to improve and make our salaries more equitable. We continue to push very hard to get them up to a market rate in our area. We've spent actually hundreds of thousands of dollars, maybe millions, in improving your equipment, and we've done a great job of keeping your healthcare costs down. We're self-insured. One thing about this virus is it just reaches in to every aspect of your life, and you don't even realize it. Ms. Neldia talked about what the cost was just to spend 4 or 5 hours in the emergency room. And that's another topic of how much healthcare costs today. But we're self-insured. And, you know, we've had a fair number of folks who have already been sick, some hospitalized, and you know, that outbreak condition that we may have has a realistic possibility of affecting what your insurance rates are. Because remember, we're self-insured. We control what our rates are going to be by how much we're having to spend. So, you know, just think hard on it. I ask you to do that. Just think hard on it. Keep an open mind. I think Steve's got a couple words to say to you, but thank you for being here this morning. I appreciate it. I appreciate the work and the labor that you perform every day to the benefit of Pulaski County. You know, one of the things, I go to a lot of neighborhood groups and crime watch groups around the county, and one of the things I hear most often is the roads in Pulaski County are better than they ever have been. And don't be swayed by the naysayers. There's always going to be the people out there that have some kind of a bone to pick. But y'all are doing a good job. I appreciate it. I'm grateful for it. And pray that God will bless you with good health and your entire family. Thank you.
All right, so the shot clinic's going to go on until 9 o'clock. And you'll enter through this door, exit out the other one. The ladies are in there to help you fill out the paperwork. Once you get your shot, you'll have to wait. There's a 15-minute observation period. And there's places for everybody to sit in there socially distant for that. So what we'll do is anybody that gets a shot, your crew's not going to leave without you. If somebody's getting a shot, your crew's going to hang on till you get done, and then we'll start the day. We're not in that big a hurry today. But I'm going to tell you something, and some of you may know this, and some of you may not. I had COVID before the vaccines were available last November. I was sick 30 days, and probably 20 out of that 30, I was basically in bed. I have long haul symptoms. I can't smell. Well, I take that back, I can smell. But it either smells like cigarettes or gasoline. Anything I eat, I can't taste hardly anything, except maybe citrus on the sides of my tongue. Cinnamon, I can taste cinnamon. Why? I don't know. Brain fog, what she was talking about, that's absolutely real. I don't go anywhere without making notes. I didn't have to be judge to tell you. I didn't used to have to do stuff like that. I could keep something in my head, and it got done. I can't do that anymore. Fatigue, 3:30, 4 o'clock. Most afternoons when I get home, I take an hour nap. I never did that. I never did that. So when I tell you this, I can't. I'm not telling you what to do. I'm not telling you what you should do. I'm telling you what happened to me. And I had a mild form of it. I never went to the hospital. My lungs never got clogged up. I never had respiratory problems. But I'm paying for it now. So just with that in mind, you know, make some good decisions and think about what you want to do. And again today, go in. It's a quick process. The longest thing is going to be the 15-minute wait, and nobody's going to start without you. So, thank you for listening this morning, and thank you, Judge Hyde, and we definitely thank the Department of Health for being here, and thank you for being in attendance this morning. It means a lot. Thank you.